Hello, everyone. Welcome to this audio podcast. This audio podcast series, or this audio podcast, audio podcast is part of a chartered edition, an evidence-based edition. This audio podcast is part of the Advancing Healthcare Awards AHA 2024 sort of nomination edition. This audio podcast as part of a blast feature and this audio podcast as part of a Storm Robotics production. So in this audio podcast and in this audio podcast and in subsequent audio podcasts as part of this chartered edition and evidence-based edition, the 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 Renal Patient Support Group, the RPSG, and the Kidney Disease and Renal Support and KDOS group for kids are initiatives that have been put forward under under five different categories. This audio podcast will go into the category in regard to the award for best collaboration across clinical, academia, and industry. So there are varying questions. There are varying questions as part of this series. As part of this particular nomination, and so this audio podcast will go into the different questions. So one of the initial questions is summarize the project or initiative and the significance of the collaboration. So um, encouraging all healthcare professionals is where the RPSG and KDOS initiatives have focused efforts, and through the RPSG, which was established in 2009, and the KDOS initiative, which was established in 2014. These have been efforts to encourage evidence-based collaborations between clinical and academia to enhance and primarily to enhance the patient care. The second sort of question in around this particular nomination, uh, is is to provide a fuller description in around the innovation and uh, and uh, and and its implementation. So, patients and carers often have various questions relating to kidney care and following routine clinical outpatient appointments, owing to the lack of opportunities to share lived experiences through face-to-face communication. The RPSG and KDOS social media platforms that link evidence-based and scientific practice to support adults and pediatrics and young people suffering with varying forms of kidney disease. Service users utilize the RPSG because of the essence of involvement through social media platform, and this provides opportunity for patients and professionals and researchers to work collaboratively and in partnership. KDOS is the pediatric and young people's equivalent of the RPSG and supports those in varying forms of kidney disease from ages of neonate or 0 to 18 years. The KDOS team is bridging. The KDOS team have been bridging a gap that requires a more established educational and support pathway built into pediatrics and young people's kidney care. Safeguarding confidentiality and security of KDOS service users is extremely pertinent to its objectives and mission. Between the two platforms, the two social media platforms, there have been a number of outputs that link patient care with laboratory medicine, and wherein patients are encouraged and empowered to implement more informed decisions. More informed decisions. The RPSG now has over 10,000 service users globally, and KDOS has over 2,000 service users, 2,000 service users, service users or patients and carers, etc. internationally. The RPSG and KDOS are platforms for all. In around the third question, as part of this particular nomination, is what are the outcomes and benefits in terms of patient services? So between the two social media platforms, there have been vibrant online communities that have wanted to drive and integrate kidney care awareness and research with an ethos surrounding evidence-based medicine, healthcare, with scientific practices. RPSG and KDOS portfolio highlights this evidence-based practices between frontline and allied health professionals, or AHPs, and where the focus to enhance patient services has surrounded health education, thus to increase health language and literacy. The RPSG and KDOS platforms have historically been represented at the Institute of Biomedical Sciences Congress in the UK, Kidney Care Association in the UK, the International Pediatric Nephrology Association, the American Society of Nephrology, the British Association of Pediatric Nephrology, and the Royal College of Pediatrics and Child Health, and so that varying project outcomes surrounding awareness and research outcomes are disseminated in public domain. The main advantages of RPSG and KDOS collaboration is that nephrology and pathology services for pediatrics and young people and adults become substantiated. The RPSG and KDOS effort have an international the RPSG and KDOS effort have been an international effort, now near approaching 25 years. One of the other questions as part of this nomination is why was this collaboration the right one to tackle the problem or challenge? Or develop the innovation. So the RPSG and KDOS and across a clinical, academic, and industry collaborations have been inspirational because these join up science factoring a specific healthcare condition and highlighting that healthcare scientists have a position and strong focus on encouraging joined up thinking to drive practice excellence. Collaborations have an involvement ethos owing to the nature of how platforms have been co-developed. The RPSG continues to be successful owing to putting patients first and commitment to scientific healthcare practices. The RPSG and KDOS continue to challenge healthcare disparities in the public domain, working with patients and allied health professionals and healthcare professionals or AHPs. Another question as part of this particular nomination was how has the initiatives involved service users and communities. So between the two platforms, there is and are patient-focused founders and co-founders, administration and moderating teams, which have historically encouraged and supported healthcare service users. Aligned with this, there have been a science-focused prompt to encourage patient and healthcare professional involvement to work together in meeting mutual objectives and regarding scientific practices, and primarily linked to the National Institute for Healthcare Research, or NIHR, involvement framework, and additionally towards the National Institute for Care and Excellence, or National Institute for Care and Excellence, and the Medical Research Council remits. Again, many RPSG and KDAR projects have recognized the importance of service users across collaborations, and the RPSG again, RPSG and KDARs are platforms for all. And so finally, the final sort of question as part of this nomination in this category, as part of this particular category, is how can the initiatives be sustained, and what is the potential for transferability and sustainability across organizations or services. So both RPSG and KDARs have ensured there are several social media platforms utilized to integrate patient care, and a continuing ethos surrounding involving healthcare professionals, academics, and researchers to improve evidence-based practices surrounding kidney care. Both RPSG and KDARs have a patient and public involvement led efforts, patient and public involvement led efforts, or PPI led efforts, in keeping with the National Institute of Healthcare Research, or NIHR, and to support practice excellence across healthcare science and patient care. The NIHR framework continues to be a guide linked with nephrology and commitment to patient care, and this makes collaborations transferable and scalable across organizations or services. It is now approaching near 25 years between the KDARs and the RPSG platforms. That draws this audio podcast to a close. This audio podcast as part of the Advancing Healthcare Awards 2024 nominations. This audio podcast as part of Chartered Edition and Evidence-Based Edition. This audio podcast as part of a Blast feature, and this audio podcast as part of a Storm Robotics production. Thank you.